This year, 300,000 people will die in America, one of the richest and most progressive countries in the world. America has great economic power, and they have made many technological advances. It contains, however, some of the unhealthiest people in the world. According to Caitlin Rose, in 2011, in the last 20 years, the number of obese adults has increased by 60%, and the number of obese children has tripled. I have done lots of research about gastric bypass surgery, and I feel that I am qualified to talk to you about this topic today. Something needs to be done to help save the human race. But what? It is not the only solution to the world's obesity epidemic, but gastric bypass surgery has saved hundreds of lives already, and its popularity continues to grow. Today, I will talk to you about what gastric bypass surgery is, how to qualify for gastric bypass surgery, and the risks and benefits associated with the surgery. According to Mayo Clinic in 2011, gastric bypass surgery is done to make the stomach smaller and in turn make a person feel full faster. It also lowers the risk of many complications that are associated with obesity. There are two types of gastric bypass surgery. Roux-en-Y is the preferred method of gastric bypass surgery. It separates a small portion of the upper stomach from the lower stomach, so it holds about 1 ounce of food. This small pouch is then connected to the lower small intestine. Food will bypass most of the stomach as well as the upper small intestines. The other kind of gastric bypass surgery is called laparoscopic gastric bypass. In this procedure, a laparoscope is used, so it can be done in much less time. The recovery time is also decreased. According to the University of Maryland, in 2011, part of the stomach is banded by a tube, and then it is connected to the lower intestines. Although this procedure seems a lot easier, it also has a greater risk of coming undone. Now that we know what gastric bypass surgery is, we can talk about how to qualify for gastric bypass surgery. It seems like an easy fix to obesity, but there are certain requirements a person must have in order to get the procedure done. According to Mary Zellfelder, in 2005, a doctor will examine a person's physical health. A person must have a body mass index, which is a relationship of their height and weight to calculate body fat percentage of greater than 40, or they must be 100 pounds at least overweight for at least 5 years. They also must have at least one serious illness related to obesity, such as high blood pressure, high cholesterol, diabetes, or a heart condition. A person's life history will also be examined. A person will have a greater chance of being able to get the surgery if they have a family history of obesity or death related to obesity. They also must have a history of no depression, no alcohol abuse, and no other psychological disorders. Once all these criteria are met, they will be examined by a doctor, and the doctor must recommend the surgery as a benefit for the person's life. Now that we know how to qualify for gastric bypass surgery, let's talk about the risks and benefits associated with it. In your life, you must think about the pros and cons of a situation before you decide on the action you'll take. This thought process must be carefully done when you're deciding about a life-altering procedure such as gastric bypass surgery. Once the patient is given permission to get the surgery, they must carefully consider all of the risks associated with it. According to Mayo Clinic in 2012, one of the biggest but also most rare problems with gastric bypass surgery is death. Other, less serious but more common side effects include vitamin deficiency, dehydration, stomach ulcers, kidney stones, and low blood sugar. For very obese people, blood clots in the legs are also a concern because these can travel to the lungs. There's also a greater chance for developing pneumonia because of the increased stress on a person's chest. Although there are a few risks, the benefits of gastric bypass surgery greatly outweigh them. According to Mayuri Kalkami in 2012, in 75% of patients, up to 80% of excess body fat will be lost from the surgery. It can easily be kept off if a specific diet and exercise plan are followed. According to a book written by Mary McGowan in 2004, exercise helps to improve a person's blood pressure and diabetes. By walking the day after surgery and continuing to walk daily, a person can help to prevent many major complications that can be associated with surgery, such as blood clots. Losing weight also helps to maintain a healthy blood sugar, reduce joint pain, reduce blood pressure, reduce the risk of meds that are used because of obesity, and reduce the use of inhalers, and also reduce asthma attacks. A person's mental health is also increased, and they often gain confidence from losing weight. These are just a few of the many benefits to getting gastric bypass surgery. We have learned that this gastric bypass surgery has a potential to greatly improve or even save a person's life. It's true that gastric bypass surgery is a lifesaver and has helped hundreds of people to lose weight and live a healthy life. The popularity and necessity of gastric bypass surgery continues to grow. Today we talked about what gastric bypass surgery is and the two different procedures, how to qualify for gastric bypass surgery, and how the many risks or many benefits outweigh the risks of gastric bypass surgery. The future for gastric bypass surgery as a solution to losing weight is looking very bright.